I'm starting right now. Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about the atelectasis. It is another important topic of your respiratory system and it is asked as a short note. Okay. So what is atelectasis? In atelectasis, there is a loss of lung volume. There is a loss of lung volume which causes the inadequate expansion of your air space. Okay, see this, what is happening over here? You have the alveoli in lung subsegments that enters and the lungs get collapsed, which will inhibit the gas exchange, right? Like this is your alveoli. Then there you have the capillaries. In between them, what happens is you have the air exchange, the gas exchange, or you can say. So that will not occur. These are the healthy alveoli and these are the collapsed alveoli. That is your atelectasis. Okay. What is the classification? For the classification, you have first one, obstructive. First one is your obstructive. What happens in the obstructive one? There is a airways basically getting obstructed. What is the common cause of obstruction? There can be mucus plug, like in cases of post-operative asthmatic patient and chronic bronchitis patient. There can be aspiration of any foreign body that can be there in the person's body. There can be bronchial tumor, and the features that it has are the mediastinal shift towards the affected site. Like if I draw the lungs like this, and this one is your affected site. So there will be a mediastinal shift towards the affected site. What happens in the compression atelectasis? There is accumulation of fluid, blood or air in the pleural cavity. Like this is your pleural cavity that you have. There is what? There is either the fluids, either the blood or the air is getting accumulated. The examples are your pleural effusions like the CHF, chronic heart failure, infections and malignancies. Then next you have the contraction atelectasis. The causes are the fibrosis of the lung which prevents the full expansion. Examples are your pulmonary fibrosis like in the cases of tuberculosis, ARDS, silicosis and asbestosis. Features are irreversible. It causes something called as the scarring. The scarring phenomenon is seen in atelectasis. Which type? The type that it is seen in the contraction atelectasis. Okay. Next you have is the patchy one. There is a loss of surfactant or there is instability seen in the neonatal respiratory distress syndrome and or in the acute respiratory distress syndrome, and we have covered in details about the ARDS, right? They are usually diffuse and involves the scattered alveoli. For last one that you have is the adhesive atelectasis. Here you have the group of affected micro atelectasis. They are caused by the alveolar surface tension. Next, let's talk about the pathogenesis. So what happens in the pathogenesis? There is a normal alveoli, which then after the normal alveoli, what happens? There are foreign antigens which attacks the body and the surfactant basically expands. There is expansion of the surfactants that happens and the air basically gets trapped and the lungs get collapsed. You have something called as compression and contraction. What happens in the compression? In the compression, there is external pressure, prevents the inflation of the lung. Inflation means to swell up. Okay. So external pressure basically prevents the inflation of the lung. Then you have the contraction. Contraction is due to the fibrotic tissue, which prevents the expansion of the lung. Okay. Next, okay, inflation is like shrinkage and expansion is like swelling up. Okay, remember this. Morphology, you have the gross feature and the microscopic feature. In the gross feature, what you are able to see? You are able to see a shrink lung and a swelled lung, right? So this is nothing but your compression, and this one is nothing but your contraction, right? In the microscopy, you will be able to see a collapsed alveoli, which is closely packed, and there is capillary. This is the alveoli, okay? Look at this only. See this? Are you able to see that all the capillaries over here are closely packed? Next, let's see the clinical features. In the clinical feature, the person will have the dyspnea. There will be tachypnea. Next, there will be cyanosis and there will be mediastinal shift. How will you make the diagnosis? Obviously, you have to do a chest X-ray. Then you will see there is a loss of lung volume. There is a loss of lung volume. Then there is a shift. Shift of what? Shift of either trachea or either the mediastinum or either the mediastinum. Okay. Then what is the investigation you will do? You will do a CT scan that will tell you if there is any tumor or if there is any fibrosis or effusion is there. These are the investigations. What is the treatment? Treatment is obviously if there is any obstruction, what will be the first thing you do? You have to remove that obstruction. Like when there is a lot of water gets accumulated in your sink, what you do? You just see if there is anything, if there is any dirt that is there in your sink. So you try to clear that dirt out. So you basically remove the obstruction. Then there will be compression like the to drain the pleural effusion. Then if there is contraction, it is usually irreversible. So we have to treat the fibrosis. For contraction, treat the fibrosis. If there is surfactant loss, then you have to give a surfactant replacement in neonates like the PEEP and the 𝗖𝗵, continuous positive airway pressure. Journal measures, what you have to take? Journal measures that you have to take is first the chest physiotherapy. Then you have to do the early ambulation. One more thing, very important. What you have to do? You have to ask the patient for the lifestyle modification, because lifestyle modification is the very first thing that should come to your mind when you are writing the treatment portion. So this was all about the atelectasis. Let's just read what we have read. Atelectasis means there is a loss of lung volume due to any obstructions. These are your healthy lungs. These are your collapsed alveoli. Classification, you have the obstructive one that are due to the obstruction, compression one. Then you have the contraction atelectasis. Then you have the patchy one. Then we have seen that the pathogenesis of the atelectasis, morphology, gross features and the microscopic features. Then we have also seen the clinical features. For the diagnosis, what you have to do? You have to do the chest X-ray. Then for the treatment, if there is any obstruction, you have to remove the obstructions and treat the patients accordingly, according to the conditions, according to the stage of atelectasis that he or she is presenting with. Okay, so this was all about this chapter. This will be asked as a short note, or if not in short note, it will be asked as a 2-mark question. So please try to make sure you read this topic very well, and I hope and I believe that I made this topic very clear for you all. Thank you so much. If you're having any sort of doubt, please feel free to DM me anywhere. Thank you.